Ever feel like, in medicine, some situations need a serious playbook? Like what happens when someone needs care that's, well, beyond your average ER?
Beyond the typical hospital, for sure.
Exactly. That's where transfer to definitive care comes in today's deep dive topic.
And it is a deep one. Think less of a quick ambulance ride and more like a high-stakes handoff in a race against time. We're talking about getting a patient to the exact right specialist, often in a really critical window.
You requested this deep dive because you're clearly curious about those inner workings, and trust me, we've got some fascinating insights from recent research. It's way more intricate than I'd ever imagined. Like, for starters, why does a transfer even become necessary? It's not just about bumping someone up to a fancier hospital, right?
Right. It's definitely more nuanced than that. We're talking about those serious situations, someone with severe trauma, multiple injuries where different specialists need to be involved, or cases that just require, care beyond a hospital's usual capacity.
Makes sense. So it's about having the right resources for a complex problem.
Exactly. I can give you an example that always stuck with me. I once treated a patient with a really complex pelvic fracture after a car accident. His local hospital was great, don't get me wrong, but they simply didn't have the surgical expertise this guy needed. And that's when transferring to a level 1 trauma center became absolutely critical.
Okay, so level one, that implies there are different levels of trauma centers. What makes them different?
You're catching on. It's essentially a ranking system based on available resources and specialist availability. Level 1 is the highest, meaning it's equipped to handle, well, pretty much any critical situation 24/7. Think dedicated surgical teams, advanced imaging the works. So for my patient with the pelvic fracture, getting him to a level 1 center meant immediate access to the best possible care for his injuries.
That makes total sense. Mashing the patient's needs with the right level of resources. Our research outlines this whole transfer process, and honestly, it's like a carefully choreographed dance, but with, life or death stakes.
It absolutely is. And
Right.
it all starts with stabilizing the patient before they're even moved. We call it the ABCDE approach: airway, breathing, circulation, disability, exposure. It's about ensuring the patient is as stable as possible before they're even loaded into an ambulance.
So it's about more than just, say, stopping the bleeding.
Hmm.
It's about prepping the patient for the journey ahead.
Exactly. A strong foundation is crucial for what comes next. You're exactly right. Strong foundation, that's key. And speaking of what comes next, once they've stabilized the patient and chosen the right facility, it's time for the transport itself.
The actual journey.
Right, the journey. And you might think it's as simple as, well, throwing them in an ambulance and hitting the gas.
Like in the movies.
Yeah, not quite. It's a whole lot more nuanced than Hollywood makes it seem.
Okay, so spill the tea. What are some factors that actually come into play when deciding how to move someone? Is it always an ambulance?
Not always. Distance is a big one. Then there's the patient's condition, of course. And believe it or not, even the weather can be a factor.
Wow, so many moving parts.
For sure. I've seen situations where a helicopter was the only option, especially in, say, rural areas or after a major highway accident, something like that. Because, time is of the essence in
Right.
so many of these cases, especially time-sensitive conditions like strokes or heart attacks.
Right. Every second counts. That actually reminds me of this documentary I saw about air ambulances. Talk about high-pressure situations.
Mm.
And it really made me realize just how much goes on behind the scenes during these transfers. It's more than just the ride itself.
You're hitting on a crucial point. Communication, for example, is absolutely paramount throughout this whole process. Think of it like a relay race, where the baton is critical patient information.
Oh, I like that analogy.
The sending hospital has to give the receiving team a detailed report about everything: the patient's condition, treatment given, ongoing needs, so there's no break in care during that transfer.
It's like that moment in a cooking show where one chef hands their dish off to another to finish it up, right? You really don't want anything to go wrong at the last minute.
Perfect analogy, and it doesn't stop there. Throughout the journey, there's constant monitoring going on: vital signs, pain management, even something as simple as making sure the patient stays warm enough. Remember, we're often dealing with a moving vehicle here.
Right. It's not exactly like being cared for in a stable hospital bed. I never even considered the bumps, the turns, all while managing, a serious medical condition.
Exactly, and that's why specialized training is so critical in this field. You need to be able to anticipate potential complications in that kind of environment, manage all the medical equipment, and be prepared to act quickly, all in a moving vehicle.
Wow. It's like those mobile hospitals you see in disaster movies. But this is everyday life for you guys. So we've got stabilization, transport, constant communication. It's so much more involved than most people realize. And our research also mentioned these things called specialized transfers, which sounds even more, I don't know, intense.
Oh, it definitely can be. Just imagine transferring a premature baby, for example. They require such specialized neonatal care, specialized equipment, and it's this incredibly delicate dance to keep them stable during a transfer.
I can only imagine. It just blows my mind, the level of care and precision needed in those situations.
It's truly remarkable.
And it's not just babies, right? Our source mentioned pregnant trauma patients. That's a whole other, I mean,
A whole other ballgame. You're essentially dealing with two patients in one. You have to think about the mother's injuries, of course, but also the well-being of that unborn child. It requires serious coordination between trauma specialists, obstetricians, sometimes even neonatologists, a true team effort.
wow. It really highlights how every single transfer is unique with its own set of, well, challenges. And then you have those situations you just, I don't know, hope you never have to face, like a mass casualty
Yeah.
incident.
Those are the ones that really test the system. Suddenly you're dealing with this huge influx of patients who need to be assessed, triaged, and potentially transferred to different facilities with the capacity and specialties to treat them.
Oh, man. It's like that classic scene in every medical drama where the ER doors burst open and everyone jumps into action.
Right, except in real life, it's less about the drama and more about carefully orchestrated chaos, you know? You need those clear protocols in place. Effective communication is paramount, and the ability to adapt quickly to these evolving situations, that's key.
So even after that ambulance arrives at the receiving hospital, the work still isn't over.
No, not at all. The receiving team needs to be ready to, as they say, hit the ground running. That handoff is critical, like passing, well, we'll stick with that baton analogy, a very fragile baton.
Okay, I'm loving that analogy, the pressure to not drop the baton. Right. So what actually happens in that final handoff to ensure a smooth transition?
It boils down to clear, concise communication, a comprehensive report from the previous team, a verbal update on the patient's current status, and making sure there's a shared understanding of that ongoing care plan. Those are all absolutely crucial.
It's amazing to see just how much emphasis is placed on communication during this whole process. It really is like the glue that holds everything together.
100%. Without effective communication, even the most carefully planned transfer can go sideways, you know? We rely on each other, paramedics, nurses, physicians, to share information seamlessly. That's what ensures the best possible outcome for the patient.
This deep dive is really opening my eyes to the intricate web of care that surrounds a patient during a transfer. It's like this hidden world most people never see.
And a critical one.
Absolutely. It's incredible to think about the future of something so critical, yet, like you said, often unseen. We've learned so much about how transfer to definitive care works right now, but it seems like this whole system is always adapting, always improving.
Exactly. That constant evolution is what makes this field so fascinating, honestly. We're always striving for those better, faster, safer ways to get patients the specialized care they need, precisely when and where they need it most.
This whole deep dive has really highlighted how it's such a team effort, like a carefully coordinated relay race, from the moment someone needs that higher level of care all the way to the finish line.
Couldn't have put it better myself. And like any winning relay team, communication is absolutely key. That's one area in particular where I see even more potential for improvement down the line.
Oh, interesting. Like what?
Well, imagine if we could streamline communication even further. Like, what if we had universal electronic medical records that everyone could access? Or even AI-assisted handoffs to make sure nothing gets missed?
Wow, AI stepping in to make sure that critical information doesn't get lost in translation. That's kind of mind-blowing.
It really is incredible. And who knows what other technological advancements are just around the corner. We're already seeing drones being used for medical deliveries in some areas. Maybe someday they'll even play a role in actually transporting patients, especially in those really hard-to-reach locations.
Drones as ambulances. Now that's a future I'd like to see. It's exciting to think about the possibilities. This deep dive has been a wild ride, from understanding those different levels of trauma centers to imagining a future with drone ambulances.
It just goes to show how complex and constantly evolving the world of transfer to definitive care really is. It's more than just an ambulance ride. It's a complex, interconnected system designed to get patients the right care at the right time, no matter the obstacles.
Absolutely. A huge thank you to you for guiding us through this fascinating and intricate world.
Happy to be here. It's a topic I'm passionate about, for sure.
We can tell.
Oh.
And to our listener, we hope this deep dive has given you a newfound appreciation for the incredible, often unseen work that goes into ensuring patients get the definitive care they need every step of the way.